This is LGBTQ Nation's Authentic Voices of Pride, presented by Chevrolet. I am Billy Porter, and in this episode, we're discussing LGBTQ plus healthcare.
We forget that queer people do have specific health problems that are different than our peers. Something I've experienced a lot is really having to teach healthcare providers what it means, and also having to teach them the things that I need, and receiving a lot of stigma along the way. We can train healthcare providers to be better healthcare providers for LGBTQ people. My name is Jona Tanguay. I'm the Vice President for Education at GLAMA, Health Professionals Advancing LGBTQ Equality, which is an association of LGBTQ and ally healthcare providers working in advocacy. I'm a healthcare provider at Whitman Walker Health.
Growing up, my experience with healthcare was put some Neosporin on it and you'll be fine. You didn't go to the doctor unless your eyeball was falling out the socket. Growing up in a Black family in America, there's not a whole lot of trust with the medical profession, so I didn't really have a relationship with healthcare until I was an adult. I moved to New York December 27th, 1990. I entered my adulthood living my dream. I was cast in the original cast of Miss Saigon. So I had medical insurance. Because of the community that I was in, there was always a place for me to be taken care of when I needed it.
Growing up, my mother lived with cancer. What drew me into medicine and working with marginalized communities, I was oftentimes in hospitals, and I had a very positive association, and it just felt like the future inside the building. I saw firsthand the issues affecting this community, being part of this community as well. I felt like these people were misunderstood, especially queer people who use substances. There's so much stigma for being queer and then also for using substances. And when we think about those things together, I saw that they got much, much worse care.
I am Admiral Rachel Levine, and I am the Assistant Secretary for Health at the United States Department of Health and Human Services. There are significant health disparities both for physical health and in terms of mental health. We know that LGBTQI+ people have more rates of chronic illness. They have higher rates of issues of depression and anxiety and other mental health issues.
Some of the biggest concerns for LGBTQ people trying to access healthcare are cost, and then also not being able to access care that is for them, and also being written off by their healthcare providers because of their gender identity.
I had healthcare for the first decade of my adult life, and then I did not have healthcare. I always felt like I was running, trying to find the job so I could have healthcare.
We know that African American LGBTQI+ people, Hispanic, Latinx, American Indian, Native Alaskan people in our community face even more health issues. It's because of systemic oppression and systemic racism that we have seen in the United States.
When you have the experience of multiple forms of oppression, those are additive, not substantive. So people who are Black and trans are much more likely to experience worse health outcomes, to develop a substance use disorder, than people who are just one of those identities alone. And why is that happening? A lot of it has to do with the stigma and the intersecting oppression that they're experiencing, as well as the general healthcare access issues in that region that are experienced by all. I think of the trans broken arm syndrome, when people go in to seek healthcare and then everything is attributed to their identity, their gender identity, or their use of hormones, when really it has nothing to do with it.
I've had very affirming care, and it was the Actors Fund. And they hooked me up with a doctor, who I'm still with today, who had lost his lover to AIDS and had dedicated his practice to AIDS work.
I went to medical school from 1979 to 1983, and at that time there was really no education about LGBTQ+ issues in medical school or very much in our training. That was at the same time that we were starting to see the spread of HIV/AIDS, although we didn't even know what the cause of the condition was.
I was diagnosed HIV positive in 2007. I had a lot of shame surrounding the HIV diagnosis because I'm the generation that's supposed to know better. The scary part was to speak about it out loud. And then when Pose happened, my character is HIV positive. And so here I am telling this story. There's a healing I have found inside of the truth. Art imitates life, life imitates art. And it just felt weird to me that I had lived long enough to see the day where a show like Pose could exist and then be on it. My character is HIV positive. I was like, I have to say something. I really get emotional when I talk about it because I don't know where I would be had that show not happened. I know that art has the power to heal.
We have made so much progress in terms of the evaluation, the treatment and prevention of HIV. We have what I would have thought of as being medical miracles. We have PrEP to prevent someone who potentially exposed from getting HIV. We have treatment so that U equals U, that undetectable equals untransmittable. But the challenge we have right now is getting those to the people who need it most. And that gets back to the health equity issues that we've been talking about.
A lot of our patients, it's very difficult for them to come into the clinic, be it that they don't have access to transportation or it's expensive, or they are living with disabilities that make it hard to come in. So it's important for them to be able to receive all their care in one place. I might be doing primary care and preventative medicine, as well as HIV and PrEP care. And then I also do gender affirming care, but I also treat a lot of queer people specifically who are living with substance use disorders, and I really love doing that. So for this first visit, it's a little bit like an interview. We'll go over your health history. But first, did you have any concerns that you wanted to get addressed today?
Healthcare professionals, physicians, nurses, therapists need to provide that culturally competent care in general for all communities, but in this case for our LGBTQI+ community. I think it needs to start in our training and in school.
Future healthcare providers, the next generation, is focusing on giving problem-solving skills so that healthcare providers, even if they don't know everything, because no one can know everything, at least know the resources and how to find that information.
I think medical schools could do a lot more with training new doctors to understand the diversity of the world. My doctor, his work is about affirmation. He's dedicated his life to making his patients feel seen. Start with do no harm and no judgment.
I think it's absolutely wonderful that LGBTQI+ people are being educated to work in healthcare and are working in this field. I think it's really important that as we do that, we expand care for members of our community, that we educate our peers and allies in terms of cultural competency.
We first have to acknowledge that we've made great strides, especially in the base levels of tolerance. More and more healthcare providers know to ask about pronouns, are putting materials out in their waiting rooms that are more gender neutral and able to represent people from a more diverse perspective. However, I really think the next step is getting the content to healthcare providers. And what does that look like? It means really targeting health professional training schools, making sure that they have an adequate amount of curriculum. A lot of times, all of LGBTQ health is shoved into a 1-hour lecture, and that really just doesn't do it justice.
I hope speaking out about my health will, first of all, smash the stigma that's surrounding it. And I hope that I can be an example of what your life can look like. I am the healthiest I've ever been. I stand as a representation of health.
What inspires me to keep on working in LGBTQ health, it's really because I believe it's a privilege to serve these communities. They feel like my family to me, and so that's why I love practicing in a community health center, is this sense of community, this sense of belonging I get is very precious to me.
I am what HIV looks like today. The hope is other people will be seen and feel hope. I was always told that my queerness would be my liability. My queerness is now my superpower.